Medical care in the country is a concern as more than 200 healthcare workers are off the job in quarantine. Among them, 96 doctors and 62 nurses from the Princess Margaret Hospital alone. Health officials revealing that those professionals were possibly exposed to the COVID-19 virus, but that number could drop after a proper assessment. We spoke with Deputy Chief Medical Officer Dr. Delon Brennan on that.
What we have done is basically taking, out of an abundance of caution, remove people from direct patient care until we can do a more in-depth analysis of what their exposure may have been. What we find is that, yes, people may have been in the general area, but they may not have been involved in direct care with the patient, may not have been in the area for any prolonged length of time. They may have had on the proper protective equipment. So what we need to do is use our risk analysis tool once we've identified who the people may have been, and then we go through that. So it's just a lengthy process going through the tool with each and every one of those 200 people to figure out who would be able to come back into service and who won't. But what we usually find is that, because we've done this before with potential exposures, is that most people are actually able to return into service without necessarily the need for quarantine or isolation, because they didn't have the kind of exposure that would be considered significant.